Treatment for borderline personality disorder, BPD, dialectical behavior therapy, DBT. Dialectical behavior therapy, DBT, is one of the most well-established and effective treatments for borderline personality disorder, BPD. Developed by psychologist Marshall Linehan in the late 1980s, DBT was initially designed to help individuals with BPD manage their intense emotions, impulsive behaviors, and interpersonal difficulties. Over time, it has become the gold standard treatment for BPD and has been shown to significantly reduce symptoms, improve emotional regulation, and enhance overall quality of life. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore what DBT is, how it works, and why it is so effective in treating BPD. We will also examine the core components of DBT and discuss how it helps individuals with BPD develop the skills they need to lead healthier, more stable lives. What is dialectical behavior therapy, DBT? Dialectical behavior therapy, DBT, is a type of cognitive behavioral therapy, CBT, that was specifically adapted for individuals with emotional dysregulation and impulsivity, which are central features of borderline personality disorder, BPD. DBT incorporates mindfulness, acceptance, and change strategies, which are particularly useful for addressing the extreme emotional experiences and relational challenges that individuals with BPD often face. The term dialectical refers to the balance between two seemingly opposite forces, acceptance and change. In DBT, individuals learn to accept their feelings and experiences as they are, while simultaneously working to change the behaviors that are problematic or self-destructive. This dialectical approach is particularly effective for people with BPD, as they often experience intense internal conflicts between wanting to accept themselves and needing to change certain behaviors that contribute to emotional suffering. The core components of DBT. DBT is structured into several key components, each designed to help individuals with BPD develop skills in managing emotions, improving interpersonal relationships, and reducing self-destructive behaviors. These core components include 1. Mindfulness. Mindfulness is the foundation of DBT and is used throughout the therapy process. It involves paying attention to the present moment in a non-judgmental way, helping individuals become more aware of their emotions, thoughts, and bodily sensations. Mindfulness skills in DBT teach individuals to observe and describe their feelings without becoming overwhelmed by them. For someone with BPD, mindfulness can help them notice when intense emotions are building and make it easier to pause before reacting impulsively. It also helps individuals develop greater acceptance of themselves and their emotional states, which can reduce feelings of shame or guilt. 2. Distress tolerance. Distress tolerance skills help individuals cope with intense emotional pain without resorting to destructive behaviors like self-harm, substance abuse, or suicide attempts. These skills teach how to tolerate distressing emotions and ride out emotional storms without acting impulsively. Distress tolerance techniques include distraction, self-soothing, accepting reality, and pros and cons analysis to help individuals make more rational decisions when faced with emotional crises. This component is particularly important for individuals with BPD, as they often experience emotions so intensely that it feels unbearable. Learning distress tolerance skills allows them to survive these moments without resorting to harmful behaviors. 3. Emotion regulation. One of the core features of BPD is emotional dysregulation, where emotions fluctuate intensely and rapidly. Emotion regulation skills in DBT are designed to help individuals manage their emotional responses and reduce emotional vulnerability. These skills help individuals identify and label their emotions, understand their triggers, and learn ways to decrease emotional sensitivity. For example, a person with BPD might learn to recognize when they are becoming overwhelmed by anxiety and use strategies like breathing exercises or mindful observation to reduce their emotional intensity. Emotion regulation also includes learning how to increase positive emotions and reduce negative emotions, contributing to overall emotional stability. 4. Interpersonal effectiveness. Interpersonal effectiveness skills focus on improving how individuals with BPD interact with others. People with BPD often struggle with unstable relationships, intense conflicts, and difficulty maintaining healthy boundaries. DBT teaches skills for building respectful, assertive, and effective communication. These skills help individuals learn how to ask for what they need, say no when necessary, and manage conflict in ways that preserve both their relationships and their self-respect. People with BPD often experience all or nothing thinking in relationships, where they idealize someone one moment and devalue them the next. Interpersonal effectiveness skills help individuals with BPD build more balanced and stable relationships by teaching them how to manage emotional intensity and set appropriate boundaries. 5. Validation. Validation is an important concept in DBT, particularly in helping individuals with BPD feel understood and accepted. In DBT, validation involves acknowledging and accepting a person's feelings and experiences, even if they seem extreme or irrational. This helps individuals with BPD feel that their emotions are valid and that they are not being dismissed or judged. Validation is not about agreeing with everything the person says or does, but rather about understanding and accepting their feelings as real and important. This approach can help reduce the shame or guilt that individuals with BPD often feel about their intense emotions. How DBT works, the structure of treatment. DBT is typically delivered in 4 primary modes of treatment. 1. Individual therapy. In individual therapy, clients work one-on-one with a trained DBT therapist to address their specific issues and goals. This therapy focuses on emotion regulation, distress tolerance, and interpersonal effectiveness, using the skills learned in DBT to manage everyday challenges and crises. The therapist helps the individual identify patterns of behavior and emotional triggers and applies DBT strategies to address these issues in a productive way. 2. Skills training group. In a skills training group, individuals participate in a group setting where they learn and practice the core DBT skills. This group is often structured like a class, with a focus on teaching skills for mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. The group setting allows individuals to share their experiences, learn from others, and gain feedback from both peers and the therapist. 3. Phone coaching. Phone coaching allows individuals to contact their therapist between sessions for support in applying DBT skills in real time. This is especially helpful when the individual is experiencing an emotional crisis or facing an interpersonal conflict and needs immediate guidance on how to use DBT skills effectively. Phone coaching provides real-time support in helping individuals cope with crises and make better decisions in moments of emotional distress. 4. Consultation team. The consultation team is a group of DBT therapists who meet regularly to provide support and feedback to each other. This team helps ensure that therapists remain effective, focused, and motivated in their work with individuals with BPD. Why DBT is effective for BPD? DBT is particularly effective for individuals with BPD because it provides a structured and comprehensive approach to addressing the unique challenges of the disorder. Unlike traditional therapies that may focus solely on talking about issues, DBT emphasizes skill building and practical techniques for managing emotions and improving relationships. Some of the reasons DBT is so effective include: focus on emotion regulation. DBT helps individuals with BPD learn how to manage the intense emotions that often lead to impulsive and destructive behaviors. Comprehensive treatment. DBT addresses all areas of an individual's life, including emotional regulation, interpersonal relationships, and self-destructive behaviors, leading to significant improvements in overall functioning. Combination of acceptance and change. DBT balances acceptance of the individual's current emotional state with the desire for positive change, which is essential for individuals with BPD who often experience shame and self-criticism. Increased sense of self-worth. As individuals with BPD develop better emotional regulation skills and healthier relationships, their self-esteem and sense of identity improve, leading to greater stability and fulfillment. Conclusion. Dialectical behavior therapy, DBT, is a highly effective treatment for borderline personality disorder, BPD, offering individuals the tools they need to manage intense emotions, improve interpersonal relationships, and reduce impulsive behaviors. Through mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness skills. DBT empowers individuals with BPD to lead more stable, fulfilling lives. In future episodes, we will continue to explore other treatment options for BPD and how individuals can learn to manage their symptoms and achieve lasting emotional stability. Stay tuned for more insights into borderline personality disorder and its treatment.